last 2.5 years have been a roller coaster. All the EDs are under pressure, and what we're having trouble with is getting patients out of the emergency departments.
My CT scans, is it volume or?
Yeah.
We're starting to feel the brunt of it now and feeling quite tired and fatigued.
Australia is in the throes of a healthcare crisis. This third Omicron wave has led to hospital wards being inundated and pushed to their capacity.
We're in a world of pain with our hospital system across the country this winter.
Mark Putland leads the emergency department at Royal Melbourne, one of the busiest hospitals in Australia.
Patients used to arrive here a little over 6 months ago, get seen by one of our doctors, get initial treatment, stabilisation, referred onto an inpatient unit, and they'd be in a hospital bed on average 3 hours after they arrived. Now patients the average is about 10 hours.
Royal Melbourne, like many hospitals, is temporarily cancelling some elective surgeries to keep up, as well as using nursing students to ease the load.
There's not a lot of other things we can do.
We're sort of more short-staffed than we normally would be. It sort of feels like the new norm.
But staff believe the issue of capacity shortages has been a long time coming.
We are busy, but EDs are in trouble because of a whole hospital system problem.
Over 43,000 people a day are now contracting COVID in Australia. That's seen a significant spike in COVID-related hospitalisations. Currently, more than 5,000 are admitted.
I think there are some things that are particular to the things that we're seeing around COVID and the infection rates right now, and it's also exposing some cracks and some deficiencies in our system that have been there long-standing.
The head of Melbourne University's Health Economics School, Kim Dalziel, blames the current crunch on the way hospitals are funded.
I think our funding formulas are too blunt. We pay one patient to be seen for 5 minutes, but we don't pay well for dealing with complex mental health problems, for dealing with complex chronic disease.
She questions recent New South Wales and Victorian state government announcements which have pledged an increase in staff levels in hospitals.
Some of our state governments are also saying that they're funding more workforce positions right now. If we're announcing new workforce, who are that new workforce? And it's very difficult to create a new doctor or a new nurse on a short time frame. So I think we're facing a health system that's not fit for purpose any longer, and it's letting down the Australian public.
It was fairly shocking from the perspective that after 2 years there's still no dedicated facility for anyone who's presenting to the emergency department with COVID.
You'll be able to go, you take a right when we get up there.
Perth resident Kate Rowlands was struggling to breathe after testing positive to COVID 2 weeks ago. She initially tried to see a GP, but it was a Sunday and she couldn't find a clinic that was open.
I'd rung the after-hours GP. They told me very clearly that I had to go to the emergency department, but yet we're hearing from, the Health Minister, the Premier, all the different government departments. We're being told that we shouldn't be going to the emergency department unless it's a true emergency.
She eventually decided to present to emergency at a hospital in Perth's west.
And I spent the next 6 hours waiting in what was a space between the two sliding doors of the ambulance entrance to the hospital. So it wasn't a regular waiting room. Literally those doors were opening and closing, constantly as people were walking through them.
The federal government has conceded the nation's hospitals are barely keeping up and has promised over $130 million towards urgent care clinics to prevent ED bottlenecks.
Obviously, these hospitalisation numbers are deeply concerning, as I said, in addition to all of the other pressures that hospitals face over the course of winter. The hospitalisation rate has increased sharply over the last several weeks.
On the advice of the Commonwealth's Chief Medical Officer, state governments are now strongly recommending people wear masks, but Kim Dalziel is hoping for longer-term solutions.
The danger would be that once the infection rate eases after the winter, that we've lost an opportunity to better strengthen our healthcare system.
Back in one of Australia's busiest EDs, head doctor Mark Putland is bracing for at least another month of pain.
There's about 20 waiting for admission beds. We've got a couple going up to theatre.
On the whole, we're a very positive team, and if you walk around our emergency department, you'll see that people like working together and they like doing the job. But that said, people are needing a little bit more care and support than they've ever needed before.